Module 1 on ECG. In this video, this is the first of this series. This video will discuss about the basics of ECG learning. So if you're new to this channel, do like and subscribe. This is Medicine Beyond Harrison's. We have already discussed about a lot of antibiotics, series, antifungals, and the infection parts. Now we will discuss about the basic ECG modules, which is very important for a clinician and to understand it further for diagnosing the common ECGs in your wards and emergencies. So first things first, heart, the chambers. There are 4 chambers in the heart: the right atrium, right ventricle, left atrium, and the left ventricle. So blood flows through this way. From here it goes to the lungs. From there, from lungs it reaches the left atrium, and then to the left ventricle, and then to the systemic circulation. So the pulmonary veins drain the blood to the lungs. So right atrium receives blood from the superior vena cava and the inferior vena cava. This is through the pulmonary artery. So this is the arrows point to the direction of the blood flow. So this way. So this is the first and foremost things. So then we already know all these 4 chambers have the conduction system. So basic understanding of the conduction system is that the sinus node is present in the right atrium, which supplies to the atria, then to the AV node, then to the bundle office. Then from there it splits into right bundle branch, then into left bundle branch. So it doesn't stop here. On the right bundle branch, there goes the Purkinje fibers, reaches the right ventricle. Whereas the left bundle branch splits into 2 further components, of which one is the left anterior fascicle and the left posterior fascicle. This is very important to determine whether there is a trifascicular block or a bifascicular block, and to understand further details in the upcoming videos. So left posterior fascicle. From there it goes into the Purkinje fiber and goes to the left ventricle. Hope things are clear until this point. So to draw a schematic diagram, so this is the right atrium, the left atrium, and the right ventricle, the septum, the left ventricle. The SA node is situated here. Then from there, here is the AV node. From there it splits into right bundle branch, the left bundle branch, of which the left bundle branch splits into an anterior fascicle and a posterior fascicle. Finally it goes into the forms the Purkinje fibers and supplies the wall. So depolarization is from this direction, from here, then it goes here, then the septum is depolarized, then the free wall is depolarized, and finally the repolarization. So the overall vector is through this direction. So this is how the PQRST is generated. So we'll discuss further more about it. So a normal ECG wave has a P wave, Q, R, S, and a T wave. So this is a normal ECG pattern: P, Q, R, S, T. These are based on the vectors, of which P suggests the atrial depolarization. Q is the septal depolarization. R is the free wall depolarization of the ventricle. S is the high lateral wall depolarization. And finally the T wave is the ventricular repolarization wave. So this is the normal PQRST complexes. So how is it generated? For this we have to know about the action potential and how it is generated. So coming on to action potential. So there is a muscle cell, or the ventricular muscle cell. Then there is a conducting cell, and then there is a pacemaker cell. The muscle cell has a depolarization and repolarization phase. The action potential of a ventricular muscle cell is specialized for contraction. So it comes like this, it forms and goes like this. It has 4 phases. This is the phase 4, then the phase 0. Here, once it is depolarized, this is the phase 1. This is the phase of plateau phase, and then there is a repolarization phase, and again phase 4. For a conducting cell, it is slightly different. Conducting cell is like his Purkinje cell that is specialized for conduction. So it has a similar pattern with more peak and a smaller plateau, which is the phase 4. Again, there are 4 phases: 4, 1, 2, 3, and 4. 4 phases. Whereas a pacemaker cell has a different mechanism of depolarization. The sinus node cell has a specialized property of automaticity. So it has a phase 4, 0, and 4. So 4, 0, this is the phase 1, and the action potential reaches the threshold for firing. Then the phase 2 is short lasted, then phase 3, and again 4. This is the normal action potential of different cells in the heart. So this we have to know for further understanding of these things. So we'll go into detail of the action potential of a ventricular muscle. So again, now we'll draw it again. So this is the normal ventricular muscle action potential, where there is a phase 4, 0, 1, 2, 3, and again 4. From here till the generation of the next depolarization wave is called the resting phase. Whereas this phase till the action potential reaches, this is called the depolarization phase. The entire remaining area is the repolarization phase. So this is the 0 millivolt, this is plus 20 millivolt, and this is normally minus 90 millivolt. So here the potassium channel opens, reaches the rapid peak firing phase. Here the ventricular muscle started contracting, then it maintains a plateau phase. This is the phase 2 due to potassium channel opening and incoming. Then there is rapid efflux of potassium channels, so finally reaching the phase 4. So the action potential of a ventricular muscle is shown here, corresponds to the resting potential, which is approximately 90 millivolts. Then when the cell is depolarized, the potential abruptly changes from 90 millivolts to plus 20 millivolts. Then it is represented by a rapid upstroke or a phase 0. So phase 1 returns the overshoot to a neutral point, that is 0 millivolt. Then phase 2 corresponds to a plateau phase in which the potential is maintained at 0 millivolt for a constant duration. Phase 3 returns the potential rapidly to a resting baseline of minus. So this is the basics of action potential. So we have got to know about the conduction system. This region is called the interventricular conduction zone. This entire region is called the interventricular conduction zone. From the AV node below that, everything is called the interventricular conduction zone. So again, the sinus node is the origin of the normal electrical impulse and is the pacemaker of the heart. Sinus impulse spreads to the atria before it is propagated to the ventricles of the AV node and further to the specialized conduction system. So now, the atria, how it gets activated. This is where the important concept lies. So the atrial activation. So how the P wave is formed. This is where it starts and how the P wave is formed. So suggesting this is the P wave. We'll take part by part. So this is the first part of the P wave. So initial half of the P wave is due to activation of the right atrium, whereas the later phase, say phase 2, is due to activation of left atrium. So basically the sinus node fires the impulse. From here the sinus node fires an impulse. It goes into the ventricle atrium, right atrium. This is the right atrium, then the left atrium. So this is the right activation of right atrium, which generates the initial first half of the P wave. Then finally the vectors reach to the left atrium. Then there is a completion of the P wave, leading to a normal P wave. So then it finally reaches the AV node, goes into the ventricle system. So the terminal half of the P wave is actually shorter than the initial half. The initial half has a good wide contour, whereas the terminal half is like this. So this is also suggestive of a normal P wave. So then it goes into the AV node. So from here, the P wave AV nodal conduction is so now we have got a atrial contraction, the P wave. So this is a phase where there is no electrical activity is recorded in the ECG. So no electrical activity. Why? Because the impulse traverses through the AV node. AV node. So then his bundle branches, fascicles, and then Purkinje fibers. In this short span, in this area, which is called the PR segment, this area is a no electrical activity zone, where the impulses traverse to the AV node, then reaches the his bundle, then reaches the fascicles, and to the Purkinje system. Also, so in all these phases, there is no muscle involved. So in this phase, the electrical activity is nil and isoelectric phase. So now we'll discuss more about the QRS complexes that we'll discuss in the next video of the ECG series. So until you wait for the next video, if you like this video, do like and subscribe. This is Medicine Beyond Harrison's. Thank you for watching.